In recent months, the political climate in Sierra Leone has taken a tumultuous turn, particularly following allegations against President Julius Maada Bio and his connections to drug trafficking. As citizens grapple with the ramifications of these claims, it is essential to remain vigilant and not easily distracted by government tactics aimed at deflecting scrutiny from pressing societal issues. The backdrop for this situation is troubling. Just weeks ago, the Sierra Leonean embassy was implicated in a cocaine scandal, further exacerbating the country's image as a potential hotspot for drug trafficking. This perception is not just damaging to Sierra Leone's reputation on the international stage, it also has profound implications for the youth of our nation, who are faced with the horrifying reality of rising addiction rates and the erosion of societal values due to drugs. The increasing prevalence of drug abuse among the youth is a crisis that cannot be ignored. Families are torn apart as addiction takes hold of individuals, leading to dire consequences not only for the users but for the community as a whole. Reports of rising substance abuse have prompted worldwide concern, and countries are increasingly scrutinizing Sierra Leonean citizens as they traverse international borders. Discrimination and stigma against our people exemplify the reality we face, a nation under the microscope due to the actions of a few. Rather than divert our gaze towards convenient targets, it is imperative that we focus on the root causes of this crisis. Sierra Leone needs to enhance support systems for our youth, establish better rehabilitation programs, and foster an environment that promotes healthy lifestyles free from the allure of drugs. Addressing addiction requires a multifaceted approach involving education, community support, and access to mental health resources. The attempt to shift blame onto individuals like Camaremba is not only a political ploy but also a dangerous precedent. It enables the government to evade accountability for its own role in addressing these societal issues. Citizens must remain conscious of this tactic and question the motivations underlying such distractions. By doing so, we can advocate for real change and demand that our leaders prioritize the health and well-being of Sierra Leoneans over political expediency. Moreover, we must hold our government accountable for implementing policies that tackle drug trafficking effectively and transparently. Public trust can only be regained by ensuring that leaders are committed to eradicating the drug problem rather than merely deflecting attention from it. In conclusion, while President Bio may hope to divert public focus towards figures like Mohamed Camaremba, the pressing issues affecting our youth and our nation's reputation should not be overshadowed. Instead of succumbing to the distractions, citizens of Sierra Leone must rally together to confront the real issues at hand.